Dr. Francis Collins, who leads the Human Genome Project, now leads a competitive so-called Shark Tank, an enterprise at the National Institutes of Health to discover new ways to conduct tens of millions of additional accurate tests with quick results. Should everyone on campus be tested? On a webinar for Institutes of Higher Education on Friday, May 29, Centers for Disease Control and Prevention officials said they're not recommending that at this time you test every student, but they encouraged campuses to work with their state and local health officials. However, that doesn't take into account testing for peace of mind. Some schools may want to test everyone before they come back to campus. At least schools should want to think about randomly testing to detect asymptomatic cases, have the ability to test everyone in certain categories: healthcare, food service, cleaning workers, older faculty, students with medical conditions, students who are arriving from virus hotspots, all students in a class or a dorm where there is an outbreak or a person infected. Administrators ask me, where will I find the tests? The answer is consult your local health department and your government and your governor. Each state submits a monthly plan to the federal government outlining testing supplies and needs. Admiral Giroir's team then helps fill in the gaps. My recommendation is you want your school's testing plan to be in your state plan. A school can also contract directly with laboratories who conduct tests, review the Food and Drug Administration's list of authorized tests, or ask for help from a local university or hospital that's created its own test. COVID-19 plans should last for at least the full school year. The government's pursuing vaccines at warp speed, but no one expects them in August. In the second semester, there should be more tests, more treatments, better contact tracing, and vaccines. But amidst the flu season and the return of COVID-19, it'll be the fall of 2021 before we begin to approach normal. But students returning in the fall and their families will want and need to have peace of mind that they and their loved ones are heading back to a safe environment. Testing is the key to providing that. There are several reasons colleges have an advantage in providing a safe environment for students and faculty. One, younger people have been hurt less by COVID-19. For example, in Tennessee, nursing homes account for 5% of the cases, but 36% of the deaths. Compare that with Tennesseans under the age of 30 percent of the cases, less than 1% of the deaths. Still, there is much that we are learning about the virus, and Dr. Fauci warns us not to be cavalier about assuming the young people are not at risk. Second, colleges are notorious wasters of space. Former George Washington University President Steve Trachtenberg once estimated that a typical college uses its facilities for academic purposes a little more than half the calendar year. He said that he could generate, he said that continues to generate maintenance energy and debt service expense that contributed to the high cost of running a college. He said he thought he could run 2 colleges in the space that he has 1 college if he organized efficiently. Well, he wasn't ever able to do it that way. Keeping students 6 feet apart will be easier if colleges embrace a new efficiency and use more of their classrooms and spaces throughout the day and throughout the year, and maybe that's a lesson that will last beyond the COVID-19 crisis. Third, tracking and tracing will be easier to do at college. We know what classes students attend, what dorms they live in. Colleges take it a step further and assign seats. In classes, infections will be easier to track. Fourth, a college can presumably require students to wear masks. Perhaps campuses can make mask wearing a part of the campus culture. But college environments pose a couple of challenges as well. 19 and 20-year-olds especially don't always choose to do the healthiest thing. A national survey on drug use and health found that 1/3 of college students admitted to binge drinking in the last month, for example. And second, 86% of undergraduate students are not living on campus, according to the National Center for Education Statistics. That means that many students will leave and return, potentially exposing themselves and others to virus, making social distancing and CDC-recommended health status all the more important. What should the federal government's role be in helping colleges and universities open safely? providing advice from CDC, funding the innovations such as the Shark Tank I mentioned for tests, encouraging universities to work with states to get included in their testing plans, helping provide supplies that the states don't have, funding such as the $14 billion in the CARES Act to address lost revenues, and the federal government could provide some liability protection. Beyond that, decisions, in my view, ought to be left to individual campuses. From the small technical universities to Harvard, from MIT to the four-year Berea College in Kentucky, which is tuition-free, they're best able to make their own decisions. When I became a university president in 1988, I asked the president of the University of California, David Gardner, why the University of California was so good. And he said, well, first, autonomy. And second, the government money follows the students to the college of their choice. United States is home to 6,000 colleges and universities, arguably the best system in the world. And it's gotten that way because the institution campuses have had maximum autonomy and minimum direction from Washington on everything from curriculum, tuition, admissions policies, healthcare plans for students, compensation for faculty. The campuses themselves determine student behavior and conduct, housing, safety, and a host of other issues. So I would suggest that we follow the same tradition here. President Trump and Congress should not be telling the California State University system that it has to open in person in the fall, nor should it be telling Notre Dame and Purdue that it cannot open in person in the fall. And it shouldn't be telling Brown University that they can't test everyone if Brown wants to, and tell Indiana that it has to, or Purdue that it has to, even though they don't want to. We know that a single lost year of college can lead to a student not graduating and set back career goals. Already, disruption of university research projects have erased much of the funding that Congress has given our research universities. Many American colleges will be permanently damaged or even closed if they remain, as our witness today, Christina Paxson of Brown says, ghost towns. 2/3 of college students want to return to campus, according to the Axios survey. Mitch Daniels, another witness today, says that at Purdue, tuition deposits by incoming freshmen broke last year's record. Colleges and universities are micro-cities. College presidents and administrators can make them among the safest small communities in our country, safest communities in which to live and work during this next year. In doing so, they will help our country take its surest step toward normalcy. Senator Murray.
So hard to make it possible for this hearing to be safe and socially distant. Before we begin, I just want to say that as we see people around the country, especially young people, protesting for long overdue change, we have to remember the opportunity institutions of higher education have to help address disparities and systemic racism and their responsibility to do so. And that means as we look at the dramatic impact COVID-19 is having on institutions of higher education and talk about ways to keep students and faculty and staff safe, we absolutely have to address the unique impact this virus has on Black communities and other communities of color. We've already seen that communities of color, tribes, and other vulnerable populations face some of the harshest impacts from this pandemic. It is our job to ensure students who have been and will continue to be disproportionately impacted by COVID-19 don't see their education suffer or fall behind. So with that in mind today, we must recognize and address the disproportionate impact this crisis is having on those who are already facing challenges. Students of color, first-generation college students, students experiencing homelessness, and student parents. And we must let public health and science drive decision-making. The coronavirus crisis has deeply affected every single aspect of our higher education system, and it will have profound impacts on students and colleges for many years to come. The COVID-19 pandemic has forced institutions of higher education to grapple with unprecedented challenges from widespread closures to rapid transitions to online education to unprecedented student financial need and unemployment and sharp revenue losses and looming budget cuts. Many may not be able to reopen their doors, including many historic and under-resourced colleges that serve high populations of students who have low incomes and students of color. Faculty and staff, from professors and adjunct instructors to administrative and support staff to custodial workers and food services and much more, are wondering if they're even going to have a job to return to in the fall. And for students across this country, from graduating high school seniors to community college students to students pursuing advanced degrees and more, this pandemic has completely shattered their notion of a normal school year. They are forced to navigate this new world. Every single student across this country is experiencing unprecedented disruption, and many students will need additional support like advising and tutoring and mental health counseling to succeed in a new learning environment. But not every student is experiencing equal disruption. The pandemic has hit certain communities, particularly communities of color, significantly harder than others. And these disparities hold true for higher education, where certain student populations are bearing a heavier burden of the crisis than others. Before the pandemic started, students of color, students who are parents, first-generation students, LGBTQIA+ students, students with disabilities, and veteran students were already far more likely to struggle to meet the basic needs like food and housing and healthcare and childcare. But with on-campus resources now widely closed, this pandemic has exacerbated existing problems for many of those students. Millions of students who rely on dorms and college-managed apartment buildings have been forced home. But for many students, like students experiencing homelessness or former foster youth or students with unsafe homes, and international students are unable to return to their home countries, going home is not an option. For many students without access to a computer or the internet or a safe, quiet place to study, online learning is not an option. And with many on-campus and community childcare providers closed, the 1 in 5 college students who are parents have even fewer options for childcare. As we move towards solving the truly countless challenges facing our colleges and students, we absolutely have to keep in mind and address the unique needs of the students who have been disproportionately impacted by COVID-19 as colleges begin to reopen safely, physically, or online. We need to make sure that colleges do not rush into a decision on how to reopen without thorough consultation with public health officials. There is a very real possibility, as Dr. Fauci told us the other week, of a resurgence of coronavirus. That is why colleges and universities need a detailed plan for how to keep the campus community safe, regardless of how the pandemic evolves in the coming months. Our students, our faculty, staff, and college communities need to know that before colleges reopen their doors, they have planned for every potential outcome, every contributing factor, and every scenario. But colleges and universities cannot do this alone. They need in-depth, actionable, and detailed guidance from the federal government on best practices when it comes to how to house and feed students safely, how to minimize class size and keep students socially distanced, how to make sure library books and other shared equipment are cleaned properly and often. And when it comes to the broader community, how to keep faculty and staff members of the larger community safe, and how to minimize risk when students travel to and from campus. Those are just a few of the questions that need to be answered before schools can open safely. Doing so requires a complex planning process that we absolutely cannot get wrong. Colleges and universities need the actual support from Secretary of Education Betsy DeVos, who, instead of working with the higher education community on how to reopen safely, is forcing colleges and universities to implement a new harmful ideological Title IX regulation during a pandemic that will ensure one thing, that students already worried about the pandemic are now going to be more unsafe next school year when it comes to sexual assault and harassment. So while I'm glad I have the opportunity to hear from the witnesses today, This committee and the American people deserve to hear directly from Secretary DeVos on how she is working with the higher education community, as well as Secretary of Labor Eugene Scalia on how we can safely protect workers from the virus, and Secretary of Health and Human Services Alex Azar on how the administration is responding to this health crisis. Today, we need to not only address the immediate needs of colleges and students, but we need to begin to plan what the future of higher education will look like in the wake of coronavirus. These truly unprecedented times require bold, responsive leadership. But right now, colleges and universities are not getting what they need from the federal government. And while I am fighting to secure additional funding and address the ongoing needs of colleges and students across the country, I will continue to push this administration to not only implement the law as intended by Congress, but to step up and provide leadership and guidance to our faculty, our staff, and our students because they desperately need it. Thank you, Mr. Chairman.
Thank you very much, Senator Murray. We'll now move to the witnesses and then to senators' questions. Pleased to welcome all four of our witnesses, and we'll introduce all four, but let me ask Senator Braun to introduce our first witnesses, and then I'll introduce the other three. Senator Braun.
Mitch Daniels. The first time I met you, Mitch, was in 2015. I was a freshman legislator, and you came into the Ways and Means Committee, and I remember it was like the third year, I think, into the tuition freeze, and I think you had tuition increases for 36 years prior to when you did that. And as a entrepreneur, I asked you the question, what are you going to do to actually lower costs? Remember it vividly. You said, I'm going to look at purchasing across all our locations. Made sense. You were going to tackle fringe benefits, especially healthcare costs. I did that back in my own business in 2008, and that is a rowdy affair when you do it. But when you make it sustainable, it's great for your employees. There's no doubt about that. And you said you'd turn a 4-year degree into a 3-year degree. That impressed me. That was the kind of entrepreneurial spirit I think we need across the federal government for sure, and it addresses high education costs post-secondary and healthcare costs, the two most uncontrollable sectors in our economy. It's noteworthy that you did that without shifting from full-time faculty to part-time. You did not increase your percentage of international and out-of-state students, and you signed a book deal with Amazon that lowered costs by 30%, making it to where now tuition is less in nominal terms than it was back in 2012. Also, borrowing, down 31%. Got the Back to Boiler program, which is an income share agreement model, provides, I think, a better alternative to the Parent Plus and private loans. All of this is no surprise. As governor of Indiana, you took a chronic deficit situation, $800 million a year, turned our credit rating into AAA. Every position you held from the time of Chief of Staff for Senator Dick Lugar, whose seat I proudly occupy now, to advisor to Ronald Reagan, to the director of the OMB for President Bush, you've demonstrated fiscal conservatism, business acumen. Once again, Purdue leads, this time as a university leads reopening for institutions of higher education following the COVID-19 emergency. In a recent op-ed in the Washington Post, Mitch rightly argues that not only is reopening campus in the fall possible, but it is the duty of the university to continue to provide high-value instruction, training, and research for which the university is nationally respected. Look forward to seeing how Purdue has approached this unique challenge, how it plans to bring its campus back safely into educating. I'm proud that an Indiana institution is leading the way for others across the country. I am pleased to have its leader here today to testify virtually in front of our committee, where we can discuss these changes at Purdue more in depth.
Thank you, Senator Braun. I think I'll ask you to introduce me sometime. That was as good an introduction as I've heard of anybody. Thank you very much. Our second witness is Dr. Christina Paxson. She's president of Brown University in Providence, Rhode Island. In April, Brown announced his plan to hold classes in person this fall, creating a Healthy Fall 2020 task force to develop a plan to safely reopen campus. Dr. Paxson was appointed president of Brown in July 2012. Prior to that, she served as dean of the Woodrow Wilson School of International and Public Affairs and as the Hughes Rogers Professor of Economics and Public Affairs at Princeton University. She's been active in the fields of economics and public health, serving as the principal investigator on several research projects supported by the National Institutes of Health.
When it comes to having a safe place to return to this fall. So I really want to thank you.
Thank you, Senator Murray. Now we thank our witnesses for joining us virtually. We will ask them to summarize their statements in about 5 minutes, which will leave more time for questions by the senators. And we'll begin with President Daniels. Welcome, President Daniels.
Thank you, Mr. Chairman, and the committee for this invitation and for the good advice I know we will receive during the next couple hours. Purdue we teach everything at Purdue University, but we are one of the most STEM-centric schools, and therefore proceed from science and data when we can. And we certainly did in this case. I will say that if we had to make the reopening decision in March or even early April, we would have not been able to justify doing so. But it was only as the data made plain how highly focused the lethality of this terrible virus is that we began to come to a different conclusion. As we now all know, nationally, deaths in nursing homes alone represent over 40% of the reported fatalities. In our state, 48%, and a story this morning suggests maybe well over half. Meanwhile, on the other end of the age spectrum, the typical college age individual, we now know has a 99.99% survival rate, much higher than for many other illnesses that do affect people old and young. The COVID fatality data suggests it is not even in the top 10 risks facing our students every year, outranked by many illnesses as well as accidents of different kinds, and I'm distressed to say suicide. Meanwhile, the students are telling us very emphatically that they want to be on campus. They don't want their educations interrupted. We believe that we have fashioned ways, and other schools have, to deliver content online very capably, but that still deprives the student of many other experiences that are only available on campus in encounters of some kind with faculty and with their peers. So the plan we have assembled for our university is based on two basic strategies. One is the protection of the vulnerable to minimize the risk to those we now know are at serious or potential danger from this virus. On the other end, to maximize choice. We will say to students and to faculty, after you've surveyed all the precautions that we are putting in place, that if you're still uncomfortable, please don't come. We have an online option for you as a student. We have a myriad of hybrid options available for you as a professor. A week from today, our Board of Trustees will examine and I hope approve the third of three sets of actions that taken together constitute our plan to protect Purdue. Just to give you the flavor, at least a third of all our staff will continue working remotely indefinitely. We'll lower the occupancy of classrooms by at least 50%. There'll be a 10-foot minimum between any faculty member and any student, and those students will be wearing masks, and that faculty member will be behind plexiglass. I learned last night our purchases of plexiglass now exceed 1 mile. We will de-densify our dining. Indoor seating will not occur indefinitely. A grab and go, as the chairman said, will become the rule. In our residence halls, we've taken out over 1,000 beds. Many doubles will now become singles. We will rearrange the others so that we're looking at 13 to 14 or 15 feet distance between roommates as they sleep. Social distance will be achieved every way we can. No convocations, concerts, large gatherings, no parties. We have spent the millions already on HVAC and disinfection improvements. And then, of course, testing. We will have comprehensive screening on arrival and an extensive testing from the first day. Of course, testing of those who have been in proximity to people testing positive, and probably a lot of random testing during the semester. We have over 500 beds already set aside for the quarantine of positive testers, and we expect to have many more. All this will cost, before we're done, tens of millions of dollars, but we're just going to try to leave nothing to chance. But I want to finish by saying that we all recognize the single most important change we must make is in behavior, is in culture. We've already begun saying to our students, if you are uneasy about any of this, please don't come. We have another option for you. On the other hand, if you are going to come, please be prepared to pitch in and to comply with the Protect Purdue pledge, which we have fashioned, committing each person in our community to all the changes that I've mentioned and many more. We make no pretense to having all the best answers. We made our intentions known early, and not to preach to anyone else, but because we need every day, we think, to implement effectively a program that comprehensive. We're encouraged to see now almost all schools coming to a similar conclusion. We look forward to learning from them and from this morning's committee meeting. Thank you.
Thank you, President Daniels, and thanks to you and our other witnesses for interrupting demanding schedules to be a part of our hearing. Dr. Paxson, welcome.
Good morning, Chairman Alexander, Ranking Member Murray, and members of the Health Committee, and thank you so much for inviting me to testify at today's hearing. Before I begin, I want to acknowledge the pain that our country is experiencing over systemic issues of racial injustice. And in times like these, our colleges and universities play an especially critical role in helping communities build collective understanding and make calls for action. So thank you. Now, Chairman Alexander, you might appreciate the fact that my grandfather was a longtime faculty member at your university, the University of Tennessee, where he directed the Experimental Research Station. And I grew up hearing about the challenges that university experienced during the Great Depression. And of course, the Great Recession, which I experienced, was another time of great stress for colleges and universities. But I can say that whether you're a public or private institution, large or small, rich or poor, we have never seen anything like this. Last spring, when the coronavirus started to spread in the United States, colleges and universities had no choice but to shutter our campuses. Testing was scarce. There was no way to know if the virus was silently spreading through dormitories and classrooms. So now, as economies are reopening, we're developing plans to bring research and students back to campus. And I want to underscore that Brown will not open unless we can do so safely. In compliance with CDC and state guidelines, we will not compromise on safety. I'm cautiously optimistic that we can reopen if we continue to coordinate closely with the state of Rhode Island and develop a sound, science-based public health plan for our campus. And this plan must include all of the things we just heard about, very familiar now, for preventing the spread of infection. Testing and more testing, tracing, isolation, quarantine, social distancing, masks, and hygiene measures. We're changing how we use lecture and classroom spaces. We're adjusting living arrangements in dorms. We're developing plans for remote teaching, among a multitude of other steps. This work is complex, it is all-consuming, it is very expensive, but if this is what it takes to make a safe opening possible, it is well worth it, because there is so much at stake. First, our students are eager to come back to campus. Many say that they may delay getting their degrees if they can't return, and that would be bad for them and bad for the country. Second, a lot of federally funded research is languishing on the bench. Our researchers have been in the labs doing COVID-19 related work throughout the spring, but important work on things like Alzheimer's disease, cancer, and new energy technologies, it simply isn't getting done. Third, the pandemic has created enormous financial pressures for colleges and universities, and this will get even worse if students can't safely return in the fall. So, Brown is fortunate, we can weather this, but colleges and universities don't have the resources to do so. And if they can't reopen, they will have no choice but to lay off even more of their employees and possibly close forever. Colleges and universities, as you know, have traditionally been some of the most stable employers and consumers of goods and services in their regions. And our missions of education and research drive upward mobility, reduce disparities, increase innovation, and support standards of living. So I want to thank you for the support you've already provided for colleges and universities. Going forward, the higher education sector can't reopen without your continued support. So we need help implementing public health plans for the safety of our students and employees and addressing declines in enrollment. Another major need is financial aid. Institutions will spend tens of billions of dollars on aid for students whose parents have lost their jobs, and they may be unable to return to school without emergency assistance, even if college is open. And we can't risk losing a generation of students. Finally, universities, medical schools, teaching hospitals need estimated at least $26 billion in emergency support for research that has been adversely affected by the pandemic. This includes funding for grant and contract extensions, facility support, postdoctoral and graduate student fellowships. Now, this is a time when partnership between higher education and federal government and state governments is more important than ever. For the sake of the research and innovation that's at the core of America's healthcare industry and economic competitiveness, the cities and states that rely heavily on institutions as major economic drivers, and especially and most importantly, for the sake of our students. So thank you for the opportunity to offer testimony today, and I look forward to questions.
Thank you, Dr. Paxson, and I'm glad to hear your grandfather was at the University of Tennessee. My daughter graduated from Brown.
There we go.
So now, our next witness is Dr. Logan Hampton of Lane College. Welcome, Dr. Hampton.
Thank you, Chairman Alexander, Ranking Member Murray, and members of the committee. Thank you for the opportunity to testify today. My name is Logan Hampton. I serve as the 10th president of Lane College in Jackson, Tennessee. Lane College is a historically Black college founded in 1882 by former slave Bishop Isaac Lane of the Colored Methodist Church. Lane is an HBCU which consists of 36 buildings across 55 acres, truly creating an exceptional academic and living environment. I was asked to testify before the committee about Lane's plans to reopen our campus in the fall. Lane College began its moment-to-moment response to the novel coronavirus disease known as COVID-19 on March 7, 2020. Initially, I created and met with a joint leadership team consisting of 21 members of my direct reports, academic cabinet, and the marketing team to consider 3 options for the remainder of the semester. Option 1, vigilant. Continue face-to-face instruction with residential students while observing local, state, and federal orders, practicing CDC, Tennessee Department of Health, Madison County Health Department recommendation. The second option, remote. Move all instruction online and direct non-essential employees to work remotely. Third option, the nuclear option. End the semester on Friday, March 13, 2020. The Lane College Joint Leadership Team decided to move to remote instruction and service delivery. Each of the 819 residential students' accounts was accredited $713 for a total of $584,305, which is slightly less than 10% of the institution's auxiliary budget. 76% of the student body resided on campus. Unfortunately, due to the pandemic, Lane College laid off 21 employees and continued its previously imposed spending freeze. Nevertheless, Lane College students will not experience an increase in tuition, fees, or room and board for the upcoming academic year. As a result of consultation given by UNCF, Lane College was able to quickly establish a crisis management team with a strategy team to lead it. This team is charged with offering overall leadership of the Crisis Management Center and coordinating the weekly Lane College C19 team meeting that is comprised of the Fast Start team, members of the Lane College Joint Leadership Team, and the Pandemic Proof team. The strategy team is set to implement a detailed timeline for reopening that is further articulated in my written testimony. And due to the fluid developments of COVID-19, the strategy team has led Lane College to prepare for 3 scenarios: Lane College Fast Start, face-to-face instruction; Lane College VR, all online courses; or Lane College Soar, a hybrid of both online and face-to-face. I would be remiss if I did not thank Congress and this committee for passing H.R. 748, the CARES Act. I also thank the President for signing this bill into law. Because of the CARES Act, Lane College has access to a total of $5,278,608 in direct allocations. While I'm thankful for this, I would be remiss if I did not share with you that Lane College is bracing for revenue losses that will impact our ability to operate. And our students are enduring tough economic times that presents unique challenges, especially for students of color. With this being said, I have a number of important requests to Congress in my written testimony. But my top 2 asks would be to ask that Congress provide an additional $1 billion in funding for HBCUs, tribal colleges and universities, and minority-serving institutions. I would also firmly ask that Congress increase student grant aid in Title IV of the Higher Education Act of 1965 by doubling the maximum Pell Grant award. The majority of my students are Black Americans, and Black Americans are disproportionately impacted by COVID-19 and racism that continues to impact our nation. If the majority of my students are disproportionately impacted, then my institution is disproportionately impacted and needs the investment. For more information and details regarding my remarks, I ask that you read my written testimony submitted for your review. Thank you.
Thank you, Dr. Hampton, very much for being with us today. And our final witness is Dr. George Benjamin. Welcome.
Thank you, Chairman Alexander and Ranking Member Murray and members of the committee. Let me just thank you for letting me be here today. Just reminding all of us that public health decisions are based on risk reduction. And all of these decisions ought to be science-based, data-driven, and done in close consultation with the state and local public health authorities. All the current evidence shows that we will continue to have undetected broad community spread of COVID-19 and will continue to do so for many months to come. And we should therefore assume for planning purposes that there will be people on campus with COVID-19 infection, regardless of what precautions are taken. So to this end, let me just briefly talk about 5 overarching issues that I think we should re-emphasize. The first one, of course, is maintaining alignment with your policies with the standards of the surrounding community without utilizing public health protections that are weaker than those in place in the community in which the schools sit. The second one, of course, is recognizing that commuter schools, where the student body comes from a relatively narrow slice of the community, will have a very different risk profile than residential schools that attract students nationwide and, of course, often from around the world. Number 3, that guidelines matter. The CDC guidelines are there, and I think people should use them. Certainly focusing on issues around physical distancing, respiratory hygiene, which, of course, fundamentally means masks, hand hygiene, and routine cleaning and sanitation of services and facilities are important. And one should think of these as stacked protections that work together to reduce the risk of infection. I also believe there should be enforceable workplace regulations to protect all on campus and recommend that Congress require OSHA to propose an emergency temporary standard for infectious disease that would be able to protect all workers from COVID-19. And actually, the state of California aerosol transmissible disease standard could serve as a model for Congress. And number 4, to achieve adequate disease control in all institutions, you need to have a very, very robust campus health program, again, linked to the state and local health agency to enhance rapid availability of support for current disease control practices. Again, as you're working on that premise that there's going to be a case on campus, we should obviously assume that while most students are less likely to have severe disease when infected, the risk for serious disease is not 0. So rapid PCR testing for COVID-19 and contact tracing are the centerpiece for disease control, and a testing strategy and plan in line with public health authorities is needed. The elements should include clearly defined priorities of testing in terms of who should be tested, the role of symptom-based strategies, as well as tested employees who are high risk, either because of underlying disease or because of not only their on-campus, but also their off-campus occupations. One of the things we saw with nursing homes was the off-campus issue, and other places where nursing home workers worked put them and their patients at risk. Obviously, everyone needs to be adequately staffed and have enough personal protective equipment to ensure protection. And obviously, in the interest of time, I won't go into all the physical distancing things. You've heard a lot of those already from the college presidents. And let me endorse it that those are they're all on the right track on the things that they're going to need to do. Also, let me just reemphasize this issue of the disproportionate risk for many, particularly minorities in the community. We know very clearly that African Americans and Hispanics in particular are disproportionately at risk because they have more chronic diseases, so that if they get infected, they're much more likely to get severe diseases. And while certainly our young people generally are healthy in school, that many of those diseases occur in our young people much younger than those of us who are baby boomers today. I also just remind everyone that the schools are going to be starting right before the influenza seasons. And so the schools need to be prepared to address influenza-like illness, which of course is how COVID-19 also presents. There are a lot of really unanswered questions about who do you screen, the role of temperature taking, clearly the role of antibody testing, understanding the state of what we know about the antibody test today. And clearly robust communications are very important. Every one of these colleges already has the experience with a sick kid at school and understand the enormous work involved with a single case of meningitis at this campus. This will probably be worse with COVID-19. And then I want to just point out scenario planning. I encourage all the schools to do very active scenario planning. And in my testimony, you have the 9 that I just thought up in the middle of the night. But let me just point out about 4 of those. Number 1, obviously a student who's diagnosed with COVID-19 who lives on or off campus, on or off in-campus housing. The student, faculty, or staff member who's identified through contact tracing but is asymptomatic. An exposure of student. And while you may not have had a large-scale event on your own campus, obviously college campuses are porous and the student go elsewhere to large events. And obviously, tragically, a student death from any cause on campus may be perceived as COVID, and obviously managing that from a perspective of the university, from a risk management perspective, is going to be very important. There are lots of other considerations, and obviously in the interest of time, I can't go through all of those. But let me just finally close out with the fact that I think none of this happens without a robust, well-resourced and trained public health system in the country. And I continue to encourage Congress to support the public health systems. And I want to just thank you for giving me the opportunity to speak with you today.
Thank you, Dr. Benjamin, and thanks to all the witnesses. We'll now begin a round of 5-minute questions from senators. And I would ask the senators and the witnesses to try to keep your answers within 5 minutes because all the senators would like to participate, and we have a vote a little bit before noon. President Daniel, let me start with you. Let me ask about how much advice you want from Washington in order to go back to school safely. For example, do you think Washington, D.C., the president or the Congress ought to tell you that you cannot open in person or should tell the University of California system that it has to open in person?
I guess they'd be within their legal rights, but I hope not. You know, as every student is different, we try to remind ourselves of that. Every school in the country is unique in some way. And I thought your admonition at the beginning, Mr. Chairman, was on target. I know that others will find better answers than we had, and I hope they'll be free to do that so we can copy them.
Dr. Paxson, in an article you wrote that you wanted to test every student. The CDC has not recommended that yet. Other universities have said that's not practical. Do you think How much advice do you want from the president or Congress about how many students you should test and how you should do the testing?
Well, I think of the CDC guidelines as minimum standards. Talking to my people, my members of my medical school, as well as parents and students and faculty, they want testing. They want everybody to be tested, and then we want to do surveillance testing on a regular basis throughout the year. It's both peace of mind, but also being able to monitor the spread of infection. I think it's essential.
Let me ask President Daniel and the other presidents this question. You know, one of the opportunities we have in this crisis is to learn from it. We've compressed about 10 years of experience into 3 months in terms of at least two things. One is telelearning. What have we learned from that? And the two is the use of space. As I mentioned in my comments, the colleges are the most notorious wasters of space in America, I would think. Classes aren't usually taught in the morning or the evening or on Saturday. And is it possible that as a result of the requirement of social distancing, that a year experience of teaching classes at different times and the more efficient use of space would have some sort of lasting impact? What about the lasting impact, too, of what you've learned about telelearning? Let me start with President Daniel.
Yes, of course. There will be lasting effects of this, and I think highly beneficial. Now, space utilization has been an issue with us at Purdue for some time, and I hope we've been using it better. There's nothing unusual about Saturday classes or evening classes here, but clearly we can do better and will now. Yes, we're going to, when you reduce occupancy of our classrooms to 50% or less, by definition, you have to use time and space in ways that you weren't before. I think I made mention that we now learn so much about telework that at least a third of our employees, our staff, will now be asked and enabled to work from home on either a constant basis or at least on a rotating basis. That takes them out of harm's way, and that's going to free up a lot of space that maybe we can find creative uses for.
Dr. Paxson?
So yes, we're all learning a lot, and I appreciate your question. Just a couple things that we're learning to add to what President Daniel said. One is that, you know, the shift to remote learning, students learned, and there were many valuable lessons there. I think in the future, we may do more flipped classrooms where large lectures are not done in person. That's a great thing. Another related area that's very important is the use of telemedicine. And we've discovered, especially for counseling and psychological services, when students are in states that we can work with, and there's some bureaucracy around that, it's actually an incredibly efficient and valuable way to support our students.
Dr. Hampton, have you learned anything in these 3 months about the use of space that might be a lasting lesson at Lane College?
Yes, sir. Mr. Chairman, we certainly learned that our faculty and our institution that was committed to residential instruction could very agilely move to remote instruction. We removed every single course to remote instruction in the spring, and for us, that was absolutely monumental. I do want to go back and just say to your initial question that yes, in fact, Lane College will be open in the fall. But what we need your investment. We need that $1 billion. The greater higher education community has asked for $46 billion. We need a partnership from the federal government to help us to ensure that we have the standards, we have the facilities in place to protect our students, to educate them safely, and to deliver on our mission.
Okay. Thank you, Dr. Hampton. Senator Murray.
Well, thank you very much, Mr. Chairman. If we're going to safely reopen, public health has to drive decision-making. And according to our public health experts, that includes making sure students and staff have access to testing, the ability to safely quarantine if they're exposed to the virus, and support for isolation and access to medical care if they get sick. Students and staff need to be able to participate in their classes while also following public health advice to social distance and wear face masks and keep themselves and their families healthy. But public health experts agree we are not anywhere close right now to meeting adequate levels of testing and
I can't do today, but tomorrow, next week.
opening.
Yeah, we need to go ahead and get that plan.
Our country,
Now, the other thing is, I don't know about Thursday for him. You need to just check with his people,
somebody
but
doesn't.
maybe just check with Rick.
Is everybody else hearing
My
that?
schedule too. And if we need to, he may be tied up Thursday.
Mr. Chairman, I
If
think
that's the case,
one of
we
the
probably
senators
ought to
is
just do
not
it.
on mute. If the staff
We
could
have-
mute him, that would be great. But Dr. Benjamin, let me just direct this to you. If our country remains at current levels of testing, are colleges going to be able to keep students and employees and their communities safe?
Testing has always been the key to success here. We're finally at about 400,000 tests per day. We're not nearly at the 500,000 that we need to be, and every state's a little different. I just looked at a chart today that shows there's a huge variety of states that are not yet there yet. I think it will be a real challenge if we can't get to that bare minimum 500,000 per day. And you may know that several groups like the Rockefeller Foundation believe that we should go to 2 to 3 times that amount per day.
Okay. I've heard it said that COVID-19 is a, quote, great equalizer, but we actually know in terms of the virus's health and economic impacts, nothing could be actually further from the truth, with Black communities and communities of color being at much greater risk of getting sick and dying and of falling behind economically because of the pandemic itself. Colleges determining how to reopen have to consider those inequities in selecting the best course of action for both the students and the staff. So I wanted to ask each of our presidents, maybe in this order, Presidents Daniels, Paxson, and Hampton, how specifically are you each planning to address the alarming health disparities impacting our communities of colors as you think about reopening? And I'll start with President Daniels.
One thing that I'm very worried about is that the efforts we've made, and as far as I know, every college and university has made to successfully recruit and then, just as important, see through to successful graduation, low-income, first-generation, and minority students. We've all been making every effort we know how now for some time, and I do worry that these are about to be set back by the tragic factors that you just mentioned. I'm tentatively encouraged that as our deposits have come in, that our URM percentage seems to have held up. I was really worried, Senator, that it might slip back, but maybe not. But I do worry that our progress will be arrested, and that we're going to have, we will certainly pay special attention, again, to identifying those who might be vulnerable. That's mainly faculty and staff, but yes, as Dr. Benjamin pointed out, there are some young people who have these comorbidities that will put them very much in our sights for special attention. And I'm sure you're probably right that minorities may well be disproportionately represented in that group.
They are, yes. Well, President Paxson?
Thank you for the question. And, I've spent my life studying health disparities and economic disparities. And, when I look at it, issues of inequity are one of the major reasons why we should open. Colleges and universities are places that create level playing fields for students. And we can ensure that all students have equal access to education, the quality will be the same, and health services will be the same for all students regardless. So it's one of the major reasons why I want to get students back.
President Hampton?
Yes, Senator Murray, no doubt about it. Race, racism, and health disproportionately impact our institution at Lane College. To overcome these barriers, we need the help of the federal government. Yes, we need your guidelines, but we also need your investment. Our students need your investment. Our students need more monies to attend colleges and universities. Doubling that Pell would help to ameliorate some of those challenges that their families are having right at this very moment, as they're losing their jobs, as they're being laid off as a result of COVID-19 and the other impacts of racism. Those students, our students, my students, need an additional investment. Doubling Pell Grant would go a long way to helping them to afford the institution of higher learning.
Okay, thank you for bringing that up. In addition to the disparities I just talked about, there is a disparity of resources. amongst colleges as well, and we need to address that. So thank you very much for that answer.
Senator,
Thank you, Mr. Chairman.
your time got interfered with. If you have another question, go ahead. All right, we'll go to Senator Collins.
Thank you, Mr. Chairman. This hearing is incredibly timely because just this morning, the University of Maine and other college presidents issued a document called Sustaining Higher Education and Sustaining Maine. So I know that they are watching this hearing with great interest. My first question is for President Daniels. Colleges and universities are economic engines for their communities and their states. In addition to educating students, they employ thousands of people, administrative staff, food service workers, custodians, faculty, advisors, student workers. When the campus is closed to in-person instruction, this had a great impact in Maine on many hourly workers in particular. The University of Maine system employs nearly 4,800 employees. My question is this: should there be different testing protocols for employees who are going back and forth into their communities and then back to campus than for students who are living full-time on campus? Are you looking at that?
That's an excellent question, Senator. Thank you. Yes, we are. It was observed that at many schools, and we are one, half of our students also live off campus. Now, many of them are very close by. We're going to be working very closely with their landlords and others to try to make certain that they're following the same practices that we will in the housing that we administer. I'll just say that it's been very sad to read about so many furloughs, layoffs of staff and faculty at other schools. We haven't done that at Purdue and intend not to do that if any way possible. But it is a significant issue. You know, our principal responsibility is to our students and to our university community, but we're very conscious, as you said, that we are an economic driver that on whom many other people in the community around us do rely. And so our responsibilities to them, both from a health safety standpoint and from an operational and economic standpoint, we try never to lose sight of.
Thank you. Dr. Paxson and Dr. Hampton, in Maine, more than 7,400 students are served by the TRIO programs. And I've always been a very strong supporter of those programs because we have a great number of first-generation college students in my state. I'm very worried that if colleges do not reopen this fall, that we are going to increase the number of people who have some college but no degree, and they end up with student debt but no credential to help them pay off that debt. What do you think of expanding programs like TRIO to make sure that the student supports are there to encourage students to come back to school and to complete their degree or earn their credential if they're attending a community college?
Thank you. And the TRIO program is a marvelous program, and I am fully in support of bringing our lowest income students and our first gen students back to campus, and not just to Brown, but nationally. It should be a national priority. I am also concerned that without increases in financial aid, and actually I agree with one of the other speakers on this call that doubling a Pell Grant would be a great thing to do. These students, if they don't come back, if they defer, if they delay, they may never come back and they may not get their degrees. Another related issue, which is I think even more alarming, is if colleges and universities have to close permanently. They have a lot of students who are going to be halfway through degrees, and finding another institution to complete their degrees may be very difficult. So, we need to keep a close eye on persistence in education and degree completion, especially during this time.
Thank you.
Senator, I
Dr.
absolutely
Hampton.
support. Senator, I absolutely support the TRIO program. Lane College was a strong provider of the Upward Bound program, and in the most recent round of competition, Lane College lost out by 1 point. We were 1 point out of the funding band. That's 50 to 100 students. That's 5 to 6 faculty staff members who we lost and have not been able to provide services for. Well, I absolutely support an expansion of the TRIO program. Lane College is in East Jackson. It's an economic, it's a donut. Lane College is a $36 million engine in this area. To have a strong Lane College means to have a strong Jackson and a strong West Tennessee. And so I would very much support expanding TRIO programs and getting Upward Bound back at Lane College.
Thank you.
Thank you, Senator Collins. Senator Casey.
Mr. Chairman, thank you very much for the hearing. I want to thank you and Ranking Member Murray for calling this hearing. I want to thank our 3 college presidents and Dr. Benjamin for their appearance, as well as their testimony. It's very informative for us who have higher education institutions in our state to have this hearing. And I would just note at the outset that the pleas for help that higher education institutions have brought to Capitol Hill, including some this morning, should be mindful, all presidents should be mindful that right now, as we speak, at the beginning of June, there's no prospect for legislation right now that's related to COVID-19 in the month of June. I hope that changes, but right now the United States Senate is only doing nominations. So I hope that you would bring some pressure to bear on the majority to begin to negotiate a new piece of legislation that would address a range of issues, including support for higher education, especially for students. But let me start with the question of how students will respond to the change of circumstances on college campuses. Student compliance with social distancing or enhanced safety protocols or other measures obviously are the key to reopening safely. You know that, you've said that, and you're living that now. There are going to be substantial enforcement challenges, as you know, especially when students are not only on campus, but engaging with or interacting with members of the community for various reasons. So one of the concerns, obviously, and you all understand this, is the risk of spread within a community, asymptomatic transmission especially. So I got 3 questions for the president, and I hope I can get a question into Dr. Benjamin. Number 1 is, what are the protocols that you're using? And I know you've outlined some of those. Some of this will be by repetition. Number 2 is how you enforce those protocols. And number 3 is, how are you engaging with students right now, or have you already engaged to review and to make certain what those protocols will be in the enforcement? So in protocols, enforcement, and then engagement. Maybe we can just go in alphabetical order to President Daniels.
Thank you, Senator. Protocols are essentially about distance, about masking, about monitoring one's own system. The pledge I talked about, monitoring one's own symptoms, reporting right away for testing if anything suspected, all of that. I would say in terms of enforcement, yes, I really think the most important thing we can do is foster a culture. I'm hopeful about this on our campus. We're going to appeal to students' altruism. I see it every day, long before COVID came along. Young people in overwhelming numbers want to do good things. They want to help others. Well, here's a chance in a huge way. I'm frankly going to tell them, there are a lot of cynics out there who don't believe you'll do this. They think you're too selfish and too self-indulgent. So let's go show them how much you do care about your fellow human beings, young and old. Lastly, I will just say that This is the central question, I believe the most important one. If we do all the other things we've talked about and don't have reasonable compliance, we probably don't make it, and vice versa. A very interesting study out of Hong Kong showed that simply reaching 80% compliance with masking stops the spread of infection, lowers the R number below 1. So this really is very central. I'm hopeful, but we're going to do everything all summer long and all fall to try to foster it.
Thank you. Dr. Hampton?
Yes, sir, Senator Casey. We had some practice with this this spring when we went to remote instruction, and we had about 200 students that remained on campus, and we began to practice the CDC guidelines. And we had a group of students who decided to have a party, and they took pictures and posted it. Well, let me just say they had very good conversations with the Dean of Students following that. And so I have every confidence in our student body, because after that, our student body practiced, those 200 students, they practiced going to the cafeteria, getting their lunch, going back to their rooms. They practiced social distancing. They did operate in pods, though, where you'd see a group of students moving around together.
Thanks so much. Dr. Paxton?
Thank you. And I can add, I think it's very important that the protocols that students have to follow are, one, crystal clear, not ambiguous, not overly complicated, but grounded in public health rules. That there is an expectation that a violation of those protocols is a violation of our student code of conduct, and so they're enforceable. And, you know, ideally, though, you don't do this through enforcement of rules. You do it through changing culture and developing a set of norms where students understand that they're protecting themselves, but they're protecting their fellow students, their faculty members, people who they respect and love. And if we can get that message through, I'm very confident that we'll do well.
Thank you.
I'll submit a question for the
Senator
record
Casey.
to Dr. Benjamin.
Wait,
I know we got to go. Thank you.
sorry, Senator Casey. Senator Murkowski.
Mr. Chairman, thank you. Thank you for being here today. Thank you for your leadership in your respective schools and the leadership that you are showing as you're guiding your students and your faculty through very challenging and uncharted times. We worked hard within the CARES Act to try to ensure that we were able to get direct relief out quickly to small businesses, quickly to our schools, quickly to the individuals through direct assistance. And as I look back through CARES, it seems to me that one group that kind of got missed were students. Those who are over 16 and were not dependent on their parents, were not able to receive direct assistance. The parents weren't able to receive it on their behalf. Many times not eligible for unemployment insurance. So when I think about the impact to the students at the time, they're literally, in Alaska's specific case, spring break is underway, and they get the word, don't come back after spring break. In the University of Alaska's situation, what they were able to do was provide financial assistance to many students, from everything from ensuring that they had transportation back to their homes, shipping their belongings back, or emergency funds. And I know that tuition costs in many institutions have been refunded, but to what extent have we been able to make our students whole in terms of the costs that they incurred? As we know, most students don't have a lot of disposable income out there where they've got money in savings that they can pick this up. Were you able to fully reimburse your students for their costs due to whether it's unexpected travel, whether it's housing, the lost classes? To what extent were you able to provide that relief to your students? And we'll just start with you, President Daniels, and go down the line.
I can't say it was fully. I'm sure it wasn't, as probably it wasn't in many other contexts around the country, but I hope it was adequate. We did refund a very substantial percentage of certain of fees, housing costs, and so forth. And we had an emergency fund, which we augmented and came to the specific relief of students who made application and were having exactly the kind of troubles that you're having. I'm very attentive, though, to watching for this fall. We've increased our financial aid to the extent we could, and we'll learn a lot more in the next few weeks about whether students, pre-existing and our incoming aspiring freshmen, have been prevented by financial exigency from doing what they are very eager to do.
President Paxson?
Thank you. So like other schools, we really pulled out all the stops trying to support our students, our highest need students as they transitioned home, travel, laptops, Wi-Fi, books, et cetera, et cetera. And I think that was fairly successful. What we found, though, is that the needs are continuing and in some ways growing. As unemployment has increased, students' families are losing their jobs. Students' summer jobs they've evaporated. There's nothing for students to do this summer. And so while we're doing all we can to try to find them alternative things and things for pay over the summer, it's very, very hard to meet that full need. We have waived the expectation that students will save money over the summer to meet part of their tuition in the coming year. But we're getting requests for help with food. That's where we are.
Yeah. Dr. Hampton?
Yes, we were able to use the student portion of the CARES Act and distributed that straight directly to the students' bank mobile accounts. We were able to do that on April 30th. 78% of our students communicated to us that they needed assistance with food. 73% of our students indicated they needed assistance with housing. And so we prorated the amount for food and housing. And we also added in some support for transportation. And we distributed those funds directly to those students. Now we are using the funds to help students to return to college and to support their educational needs for a number of things, for food, for housing, for digital supplies, for digital resources, for hotspots. We are supporting those students on a case-by-case basis.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator Murkowski. We have 7 senators remaining, and everybody's doing a good job of staying within 5 minutes, which I thank you for. Senator Baldwin.
Thank you, Mr. Chairman. I am wanting to ask a couple of questions first to Dr. Benjamin. Dr. Benjamin, you stated in your testimony that every school, all schools should be prepared to have at least one case of COVID-19 on campus. Last week, I learned from the University of Wisconsin-Madison that they had run out of the reagent needed to run one of its testing platforms. And despite continuous calls for support from the administration essentially said that private labs need to rely on existing supply chains for things like reagent. Can you describe why schools need to have all of the supplies on hand, not just the testing platforms, but testing supplies in order to respond to the very high likelihood of new cases?
The challenge, of course, you have is that you're going to have a case, and you're going to have to test someone. If you don't have the capacity within your own campus health program, you're going to have the strong linkage to someone else that does. The biggest challenge we've had with all of this testing, frankly, fundamentally has been the supply line issue. And it's going to require some partnerships. It's going to require, on a daily basis, making sure that you have adequate testing capacity. And just because it's going to happen, and the way things work in the world, as you know, a case comes in, and the test isn't available. And then all of the sequelae that occur after that, which are problems, are a direct result of the inability to test. So they're going to have adequate testing. Otherwise, they can't function at all.
Yeah. Thank you. I have a second question for you. I know that in some of the testimony by both senators and our witness panel, there were references to the fact that most of the severe health outcomes from the coronavirus are among older people. And so certainly students in the typical student undergraduate age range are predicted to be more healthy. But I want to just consider several things as we move forward to seeing more campuses reopen. According to the American Federation of Teachers, the 40% of adjunct or contingent faculty who comprise 75% of total instructional staff are over the age of 60. And I'm also thinking a lot about our technical and vocational colleges that will probably, during a time of excessively high unemployment, see a new age demographic beyond what they've already seen as a result of the Great Recession. And so I'm very concerned about not only the safety and health of undergraduate students, but also faculty and the staff that work on our campuses. I'm confident that colleges and universities want to do the right thing, but they need very clear rules of the road, and workers need to know that they are protected. It's why I worked with several of my colleagues to introduce the Every Worker Protection Act, which actually requires the Occupational Safety and Health Administration to issue emergency temporary standards that cover all workers and workplaces, and requires workplaces to implement infectious disease exposure control plans to keep their workers safe. You stated in your testimony that OSHA needs to promulgate such a standard. Do you agree it's important for the safety of faculty and staff as well as students they serve that such a standard, not a voluntary guidance, but a standard be in place before colleges and universities move to reopen this fall?
You know, I've been running big organizations on and off for a long time. And unless you have standards that everybody can rely on, you're not going to get anywhere. Those standards are absolutely important to protect workers because they create, frankly, a floor that everybody can rely on. Doesn't mean you can't do more than that. But I've always argued that those kinds of standards are absolutely essential. They reduce a whole range of your risk. And so I would also agree with your statement, Senator.
Thank you.
Thank you very much, Senator Baldwin. Senator Cassidy.
Thank you, Mr. Chairman. I want to thank the university presidents for thinking creatively about reopening the school. Dr. Benjamin correctly points out that even though you're less than 25, you have less risk. The risk is not zero of health effects. But what we do know is that if you miss out on critical years of education, it's an absolute 100% risk that your future economic prospects are minimized. President Paxton, I'm struck by what you say. So far, CDC recommendations seem to be the kind of minimum standard. They're not actually kind of what we'd really like. Dr. Benjamin, first going to you, knowing that the federal government has been slow coming out with testing strategies for settings like universities, and that what they do at Lane is going to be different than what they do at Brown, different than what they do at Purdue, or at Louisiana State University or Tulane, just because of different sizes of schools. Is your organization promulgating or suggesting different strategies so that someone like President Hampton, God bless him, is able to get his university reopened and with kind of a strategy about how to use the testing which is available?
Well, while we're not specifically developing standards, we are encouraging schools and others to develop learning collaboratives so that they can learn from one another.
I'll pause you just because I just have such minimal time. I do think it's important to have a strategy. I think it's important for the federal government. I think it's important for others. President Paxton, it appears that you have put together a strategy. I just want to explore that a little bit because I think you would inform others. We understand that if you have an outbreak in a particular dormitory and it's not in other dormitories, intuitively you would devote resources to the folks in that dormitory. Is that the beginning of your approach, or how would you say that?
Yes. So, the optimal testing strategy is something we're working on really carefully. We have epidemiologists, and it's going to be data informed, and it's going to change over time. It depends on prevalence in the local area. But certainly one of the components would be if there was a student who tested positive, their dormitory, their classmates would be people who, doing standard contract tracing protocols, would be people who would be tested next.
Now, let me ask you one thing.
Yeah.
One thing we've been interested in, because there might be a limitation on the number of tests available, is the ability to batch test, to do 100 in a dorm, but if it tests positive, then you do each individually. Is that part of your strategy?
Well, we're exploring that, and that's something that's still relatively new, very much in development. Batch testing looks promising, as does wastewater testing, where you can test stuff coming out of the dorms and figure out if anybody in the dorm has it. So we're exploring those options.
You're very delicate when you say stuff coming out of the dorm.
Yeah.
President Hampton, as you put together your strategy, these folks got medical schools. Again, God bless you. You are much more constrained in terms of resources. Where are you developing your testing strategy from, and what could be done to help you or those similarly situated, my historically Black colleges and universities in Louisiana, for example, to implement such a strategy, knowing that your student body may have an increased incidence of those comorbid conditions which increase risk?
Well, I begin with number one, make the investment in our institutions. Make that $1 billion investment in the historically Black colleges, universities, tribal colleges, MSIs, and the $46 billion in the greater body. Make that investment. We had a little bit of practice with this this past spring. We implemented protocols where a student would present presented in our health services, then that student was tested for flu and they were screened. And we had one incident on our campus in the spring with students who remained on campus where a student had come in contact with a person, and we were able to isolate that person into an apartment complex, allow that person to go through those 14 days, and then have that person to not show any symptoms of those.
But let me ask you, because I'm almost out of time. The strategy that President Paxton has put together, where you may even do wastewater, but you certainly have a micro community within your campus upon whom you're focusing because they've shown to be positive, or at least one person within them. Do y'all have a similar set of protocols, or would it benefit you for those to be promulgated by some organization such as CDC or another public health organization?
It would, in fact, benefit us to have those promulgated. But we do, in fact, have partnerships with our Madison County Health Department, with our Christ Community Health Department, or Health Center, to be able to do testing for any of our students or any of our publics who believe that they have some, or who may show some symptoms, that they'll be able to go get tested and get their results back in 24 hours.
Gotcha. Thank you. I yield back. Thank you, Mr. Chairman.
Thank you, Dr. Cassidy. Senator Murphy.
Thank you very much, Mr. Chairman. Thank you all. This has been incredibly helpful for all of us. Mr. Chairman, I want college sports to come back. I want sports in general to come back. I miss it. For me, it's a release from this job, and I can't wait. At the same time, I want it to come back for the right reasons, and I want it to come back safely. And so I wanted to ask a series of questions on this topic because I think it's important. Maybe I'll start with you, Mr. Daniels. I think it's interesting that college sports teams are coming back for practices before professional sports leagues are feeling that it's safe enough to come back. And while I've read through what your university is doing to try to protect students that are returning, these are contact sports. There's no way ultimately to have social distancing for a football team or a soccer team. And so what happens if you have an outbreak? over the course of summer training or in the early fall on your football team or on your women's soccer team. What's your protocol? Do you shut that team down? Do they stop playing the season? Do you just segment off the players who have tested positive? This is a potential for a super spreading environment if you're not careful.
I completely agree with you. I think you would shut it down. And I think that we'll all, somewhere out there, someone may very well face this situation. Our teams are resuming individual workouts later than some, but they are coming back to that. They're then group workouts. The conference we belong to has prescribed some guidelines, and we will follow them and in some cases exceed them. But I think you're quite right. And we love sports too, but first things first. And that starts with the safety of people, players, coaches. Don't forget the people who may be at most risk of a spread here are the older folks, the coaches and others. So I hope we get back, but if it takes longer or if it is subject to interruption, then so be it.
Let me ask you one specific question, if I could drill down. What happens if you've got a scholarship player who doesn't feel comfortable coming back? Let's say they've got a mother at home or a grandfather that's got medical complications. If they decide not to play football this year because they just don't think it's right for them, do they maintain their scholarship?
Yes, they would. We've honored scholarships at Purdue for a long time for people who couldn't play for or continue for some reason, could be injury or some personal tragedy. So that would be consistent with our policy. And I think I can speak with authority for our athletic department that we would see that as the right thing to do and the thing we ought to do.
I appreciate that. I will note that is not right now the standard for all NCAA schools, and I think it'd be important for us to make sure it is. And then lastly, and maybe most importantly, what are you going to do about attendance at sporting events this fall? Because that's what I really worry about. You have the Iowa athletic director on the record. He's a member of your conference, saying that right now his plan is to let everybody into the football stadium, and anybody who wants to come watch can. You know, we had a situation in Westport, Connecticut before this was an epidemic where 50 people got together for a birthday party. One person had coronavirus, one of the first in the Northeast to have it. At the end of that party, half of them had it, and the virus was off and running on the East Coast. So it worries me that we are contemplating putting hundreds of thousands of adults and students into stadiums, especially when the professional sports leagues don't seem to be entertaining that idea. What's your understanding today? Are we going to have fans in stadiums for events in your conference this fall?
Can't speak for any others, but we are not looking at going beyond 1/4 of the capacity of our 57,000 stadium right now. This has been mapped out just as we have mapped out classrooms and dorm rooms to measure distance and then exceed the requirements. We would be doing that too. So it comes out to about a 1/4 on the work we've done. Now we know that outdoors is very different, that it's very hard to spread this outdoors, but we're still going to take an abundance of caution approach. I cannot tell you about indoor sports right now. I don't think I see a way that we can proceed on anything like the basis that we've all been familiar with.
I appreciate that. That's still 10 to 20,000 people all together for an event. I think that may be a pretty dangerous endeavor, and I think it's interesting compared to professional sports who have decided to make a different decision. I think it's a topic worth continuing to talk about. Thank you, Mr. Chairman.
Thank you, Senator Murphy. Senator Warren.
Thank you, Mr. Chairman. I want to start, if I can, by quickly thanking Ranking Member Murray for her comments, acknowledging what's happening in our country. We can't ignore the racist violence that has killed George Floyd and Ahmaud Arbery and Breonna Taylor and so many, many others. we must commit ourselves to change and to using this committee as well as others to advance anti-racist policies in health, in education, and for workers, including today's hearing about reopening colleges. You know, millions of families, millions of students across this country are wondering when and how colleges are going to safely reopen. And I know this is a hard question that's going to vary from campus to campus. But President Daniels, you wrote a recent op-ed entitled, "Why Failing to Reopen Purdue University This Fall Would Be an Unacceptable Breach of Duty." So your op-ed makes it sound like you have already decided that you're going to reopen no matter what come this fall. And in that op-ed, you discuss how you're going to mitigate risks to undergraduate students. But I notice there's almost no discussion of addressing risks to workers or to faculty who tend to be older and more at risk. Nothing about the risk to low-wage workers or hourly workers, workers who are often Black or brown. These workers are responsible for serving the food in the dining halls and cleaning the dorms and the classrooms and keeping your campus running. They are particularly vulnerable and they have the least power, and they are getting sick at disproportionate rates. So President Daniels, Purdue has nearly 17,000 employees. Nearly half are staff who won't be able to work normally this fall. They might get sick, they might need to care for a loved one, they might have small children that need care, or because of their age or pre-existing health conditions, they may not feel safe coming onto a college campus during a pandemic. So I just want to know, have you laid out publicly a plan for these workers?
Well, thank you, Senator.
Actually, let me just ask specifically, have you agreed to continue paying them if they can't come to work or if they decide it's too risky to show up for work?
Well, thank you I'm so glad you asked the question because, first of all, you could not have better expressed our entire philosophy and strategy. I don't know if you were here for the opening presentation, but I enunciated it then. And our entire strategy is built around the protection of the vulnerable. And that starts with faculty and staff. Starting next week, we will have one-to-one visits with our faculty to try to figure out what we have a grid that attempts to estimate their degree of vulnerability. There's some we don't want near campus at all. There are others we will make an accommodation for. But
so if I can just understand, I'm sorry, I'm just going to be limited on time here. If I can just understand, you haven't put out a plan publicly yet, and it sounds like you haven't worked one out, but you're planning to work it out one-on-one with your employees, is that right?
Our plan is entirely based on the protection of the vulnerable, and that will include trying to make individual accommodations for those about whom we have the most concern. As I mentioned, about a third of our staff.
I was asking about whether or not you'd already laid out a plan, and I take the answer on that is no. Because
no, the answer, of course, is yes. It's very comprehensive, and
I just hadn't seen it publicly. I just hadn't seen this plan laid out. Because my question is really about who has power and who has a voice in these decisions. You know, best practices are best practices only if everyone is at the table who's going to be affected when those plans are being laid out. So I just want to move on for the time being, but I'll follow up in writing to try to get public commitments that going forward you're going to include both faculty and staff at the table, and they're going to explain about how this is going to intersect with their pay and how you safely reopen this campus. Dr. Paxson, I want to stay on the topic of power and accountability. In addition to being the president of Brown University, you're also the vice chair of the board for the Association of American Universities, which signed a letter last week from the American Council on Education, which is the very powerful college lobby, urging Congress to, quote, quickly enact temporary COVID-19 related liability protections for higher education institutions and systems. Now, Dr. Paxson, as you know, current law imposes liability only when the college has behaved unreasonably under all the circumstances. The law does not impose automatic liability when somebody gets sick or even when somebody dies. Instead, it's liability only when, for example, in a pandemic, a college doesn't take reasonable efforts to clean up common spaces or to separate desperately sick students. So when colleges lobby to change that standard and to walk away from it, even if they are extraordinarily careless with the lives of their students, even if these colleges take completely unreasonable risks, even if someone dies, what message does it send to our families and our students? You know, would it make you more comfortable or less comfortable as the parent of an incoming student?
Dr. Paxton, we're well over time, but you take whatever time you need to answer that question.
Thank you very much. I do not want protection from being careless. That is not what we're about. And if we are careless, if we don't follow guidelines, that's something that should not be protected in any way, shape, or form. The fact is, though, we are in a brand new pandemic. We've never seen this before. We're in uncharted territory. I think many institutions are very nervous that even if they play by the rules scrupulously, that they will still be subject to class action lawsuits. They'll probably prevail if they've done them right, but the cost of defending those lawsuits will take money away from tuition, financial aid, not from tuition, from financial aid, and all of the support that we provide for our students. So I am in favor of very carefully crafted liability protection that in no way, shape, or form permits us to be careless with people's lives.
Well, I appreciate
Thank you,
that.
Senator
As
Warren.
we're over, if I can, I just want to ask unanimous consent, Mr. Chairman, to enter statements for the record on this issue from Americans for Financial Reform, the Student Borrower Protection Center, Public Citizen, American Association for Justice, and Georgetown law professor David Vladeck. You know, the public should know that a college, just like any institution,
Thank you, Senator
has
Martin.
to behave
So ordered.
reasonably. That's what the law requires. Thank you, Mr. Chairman.
Senator Braun.
Thank you, Mr. Chairman. I'm going to lead in with Senator Warren's question, and I think it's a valid one to ask in the sense that the safety of your employees, staff at universities, as well as your customers, which would be the students, very important. But underlying the way she phrased that question would be that it's not in the extreme interest of the university, of businesses across this country, to keep not only your customers safe, your employees as well. It also, to me, by the way it was stated, assumes that there's not going to be the agility and the ability to do both of them. And my question is going to be for President Daniels, and you can continue a response if you want to, but I think rest assured for the people that run the real economy, including teaching our students, they have in their own best interest to do all of the things this kind of bureaucratic approach has been, to where it's tamped down economies maybe unnecessarily. We're able to do two things at once. And I think that argument that you cannot operate safely and keep the disease at bay might have been an underlying strategic error in how we've addressed it in the first place. So President Daniels, as any entrepreneur, sometimes your plans don't work out the way you might hope they will. I know in building a business over 37 years, if things were growing great in the moment, I said, hey, something is going to come along to maybe try to derail it. Had the data not shown you, or if something should change, where you bring students back to school, and I think everything you've laid out makes it sound like a great plan. Let's say if not, how does your involvement with online education, I think you call it Purdue Global, would that have been a backup plan that would have come into play for your students that would want to attend on campus? Tell me a little bit about that, and then more broadly, how you think that part of post-secondary education might break the cost curve that's been so tough to do with traditional education on campus?
Senator, Purdue Global is a separate branch of our university. It serves a very different clientele. The typical student there is a 33-year-old woman with a job and usually family responsibilities. It's really aimed at that enormous universe of Americans who started college and didn't finish, and helping them get to the finish line and we hope a better station in life. Now, we learned a lot, have learned a lot about online education. As I mentioned, we will be offering to those students who can't get here this fall or choose not to come in person this fall, an online option for their undergraduate education. But Purdue Global is aimed at basically working Americans. And I will say, and your question, I think, surfaces this, with the damage we've done to this economy, it may be that there's a much greater need or greater market for very affordable, purely online education of the kind that Purdue Global and many other fine schools provide.
And then to dig into that a little more deeply, how long do you think that cost curve will take from the involvement in online undergraduate, as well as what you're learning from the trying to educate older students? Do you think that is something that's going to be disruptive enough to where, like healthcare, for instance, it costs us double here in our country, roughly, what it does in most other countries, with results that aren't any better? Do we have that opportunity through disrupting education in a way, since it's the next most stubborn cost increase each year, through technology, through something different that most of us might not see at this point in time?
The exorbitant, even staggering cost of higher education has been an issue for quite some time now. Thank you for noting at Purdue, we have not changed our tuition in the last 8 years and have pledged that that'll last at least through a ninth. We are less expensive in nominal terms than we were in 2012. And with the result, I think we've been able to attract more students and terrific students for whom affordability and accessibility is a real issue. Now, in the wake of this terrible pandemic, it seems very clear, I think, that there'll be a new pressure on schools, us and everyone, to find every way possible to make this vital service we sell more affordable. And I can't imagine you'll have any other outcome than that.
Keep it up. I think leading the way on trying to make something that is, along with healthcare for most families, the demand is inelastic. We all want it. Ironically, of course, classic economics, that's where it costs us the most in this country, and we need to do much better. Thank you.
Thank you, Senator Braun. Senator Kane.
Thank you, Mr. Chair. Thank you for this important hearing, and to our witnesses. I have been very, very critical of the administration's handling of the public health side of this crisis. There's no reason the United States should have more than 100,000 deaths. There's no reason that our economy should have been hammered by this in the way that it has, especially if you look at what's happened in other countries. Since I've been critical, and I'm going to continue to be, I also feel like I got to give credit where credit is due. The administration has done some things that I want to thank them for, and some are kind of right in this bailiwick, helping us work out implementation challenges to the CARES Act. You'll remember, Mr. Chair, after the CARES Act passed, some thought that the aid that was going to go to students might be taxable income. The administration worked quickly with us to clarify that was not the case. Some universities trying to get PPP loans were told that their student work-study students would be counted as employees, putting them over the 500 limit, disqualifying them for PPP loans. Again, the administration worked very quickly to allay that concern. And so I got to give credit where credit is due, because I'm going to turn soon to some more criticism. I do want to thank Senator Murphy for raising the football question, because it's an example of how opening is complicated. Folks who play football are amateurs. They're not getting paid. Folks who play football are disproportionately minority. There's been a number of articles in Forbes and Sports Illustrated about how football, especially in the Power 5 conferences, is a big money thing. I hope we do not, because big conference football is a big money thing, risk the lives of amateurs who are predominantly minority by going back before we can, especially because the NCAA has figured this out. When they canceled spring sports like baseball, they told all the athletes, if you want another year of eligibility, you can get it. And many who lost their last year of basketball or baseball and were sort of heartbroken about it have figured out ways to go and get a master's degree or stay at a college for an extra year so that they can have that extra year of eligibility. We can provide that experience for student athletes if they want it without jeopardizing their health, because football is a money-making proposition, and I hope we'll all consider that. All right, let me get to the critique. Mr. Chair, you said a couple of times, your whole opening statement lays it out so well. The road to reopening is through testing. The road to reopening is through testing. And I deeply believe that. There's other issues, obviously, but the road to reopening colleges is through testing. The CDC has a document that they have put out and continually updated. It's online right now. It's called Considerations for Institutions of Higher Education. The most recent update was May 30. It's a very comprehensive document. I've just got it here on my iPhone. You go through it. Principles to keep in mind, IHE, Institution of Higher Education General Settings, IHE on-campus housing settings, promoting behaviors that reduce spread, subpoints under all of these, multiple subpoints under all of these, maintaining healthy environments. Let's see, what else do we have here? So many, maintaining healthy operations, room layout, water system supplies, subpoint, subpoint, subpoint. You go through this endless document, not a mention of testing. The CDC guideline, right, preparing for when someone gets sick, endless subpoints. There's not a single mention of testing in the document that the CDC currently has to give to our universities. Now, I get it that our universities don't need a mandate, test everybody or test 1/6 of students. But universities don't all have CDCs. They don't have NIHs. They need guidance. If you're going to give a university guidance about how to make sure the water system is safe, or how to limit the size of activities, or what to do when a student gets sick, it would seem like you would give them some guidance, some recommendation about testing protocols. Mr. Chair, you laid out sort of a good one. Maybe you test everybody who's sick or anybody in vulnerable population, and then maybe you would want to do some sentinel testing randomly to determine the spread of antibodies. And it strikes me you could give that guidance to our universities without, a mandate that is too restrictive. My suspicion is this, because this has been more general with the administration. They don't want to set goals for testing because they don't want to be measured against those goals, because they know that if they are measured against the goals, we'll fall short. The only way you get to a goal is by stating it. If you don't state it, you're not going to get there. And I think our CDC does a great disservice to colleges, small, medium, and large, if they don't provide some basic guidance about what a testing protocol that would be successful would look like. And with that, Mr. Chair, I thank you.
Thank you, Senator Kane. Senator Hassan.
Thank you, Mr. Chair. And I want to thank you and the ranking member for having this hearing, and I want to thank our witnesses for all that you are doing to help your students and our communities. Between the COVID-19 crisis and the rightful outrage following the killing of George Floyd, this is a deeply challenging time for our country. That is true at our institutions of higher education, and as we grapple with how to reopen safely during a global pandemic, we must also remember that higher education institutions have historically served as places of civil discourse. As our local communities and our country works together to make our systems more equitable and just, I look forward to working with all of you. My first question is to our three college presidents. Last week, I sent a bipartisan letter to Secretary DeVos with Senators Tim Scott, Loeffler, and Booker, urging the Department of Education to immediately ensure that students receive the financial aid that they are now eligible for due to the economic impacts of COVID-19. Specifically, we asked the department to issue guidance to colleges to help ensure that students' financial aid eligibility can be appropriately adjusted, and to update the online FAFSA form to capture recent changes in income for financial aid applicants. So to each of the college presidents, and I'll start with you, President Daniels, can you speak to how your students have been economically impacted by COVID-19? I know you've done it a little bit through this hearing, but more importantly, why further action by the Department of Education is needed to help ensure that students get the financial aid that they are eligible for?
Well, Senator, I can't say that we know yet. We're in the process of finding out now which students who have expressed the desire to come to Purdue will finally come and can manage it. And I don't doubt that many of them have encountered significant economic setbacks since they expressed that intention. We'll know much more over the next few weeks. I'm hoping that most of them will be able to do it. But I applaud the initiative that you led and those who joined you in it. Clearly, we all need to do all we can to get aid more swiftly and directly and flexibly, which is a point I think you just drew our attention to every young person who needs it.
Thank you. President Hampton?
Receive Pell Grant. It is no question that our students have been negatively impacted by COVID-19. When we did our survey of our students, that survey went to the students about 5 weeks after the majority of our students had been home. And those students reported back to us while they were at home, 78% of them said, I need help with food. 73% of them said, I need help with housing. Our students need the help now. They will need the help in the fall. They did their FAFSA based on the previous income. Those incomes have now dropped. Their families will have less means to help them come August. So whether we're online or whether we're face-to-face or whether we're hybrid, our students need the help as a result of COVID-19 and the vicious effects of racism on their parents' incomes.
Well, thank you. Dr. Paxson.
So after the 2008 recession, financial aid at Brown rose by 12%. The maximum unemployment rate during that recession was 10%. We're heading to 20%. We're also hearing from students who are saying, I know my FAFSA was correct, but it is no longer in any way an accurate portrayal of my family's economic circumstances. So we are having to go back and revisit all of those aid awards because we're in an extraordinary time for students and their families.
Well, thank you. I want to turn to Dr. Benjamin now, if I can. And I know, Dr. Benjamin, you have talked a bit in your answers about what colleges need to do from a public health point of view, including robust testing and contact tracing as part of their strategy as they reopen. But you've also spoken about, even with the best public health protocols in place to ensure that students, faculty, and staff practice social distancing, recommended hand washing, and wear masks, it's likely inevitable that there will be spikes in cases on college campuses. So what protocols do you believe should be in place to contain a detected spike in cases on college campuses? And if colleges are forced to close, what can be done to ensure that students leaving campus do not spread the virus in their own communities?
And they absolutely, the reason I recommended that they link very closely with their state or local health departments is so that they can very quickly get involved in contact tracing and disease containment. Because in many cases, these will involve the community as well. And, you know, they should have plans for that. They should have pre-written guidelines for how they're going to handle it, who's on first, how they're going to manage it, who's a spokesperson for the university, how do they link protocols with the state and local health department so that there's no debate about who's actually managing the disease outbreak. I would assume that in most cases, the contact tracing activity will be done by the state or local health department and not the university. But it depends on how big the community health program is at the university. They may very well want to be involved in that. But if you don't have plans for that, it will be at best a mess. So it does require a fair amount of planning up front, and for all the various scenarios that they can possibly think of would be important for them to do.
Well, thank you. And Mr. Chair, I have lost sight of the clock on my screen,
I'm afraid
so I'm going to
we're
assume that's
well
about
over.
5 minutes. Thank you.
Thank you, Senator Hassan. Now, I'd say to the witnesses, we only have 2 senators remaining. Senator Jones.
Thank you, Mr. Chairman. I really appreciate your leadership on having this hearing, and Ranking Member Murray. And also thanks to all of our witnesses. Let me first associate myself with all of my colleagues' comments regarding the issues that we're facing in America today and the problems that we're facing. But as we see the issues out there, I'm also seeing some rays of hope. I'm seeing folks that are peacefully demonstrating. I'm seeing people that are getting together to raise their voices, but doing it together, locked arm in arm, black and white, folks of all races, religions, and walks of life. And I don't think the media often focuses on that as much as they do on some of the more violent protests, but we see it happening all the time. So I do think there's rays of hope out there. Dr. Hampton, I'd like to ask you, I'd like to follow up a little bit with you, because as you probably know that I have been one of the champions, I think, for HBCUs. We have like 13 in my state. Senators Alexander and Murray have helped us get a lot of funding for HBCUs recently. And I joined with a couple of colleagues in sending a letter asking for an additional $1 billion funding. So I'd like for you to talk just a little bit, assuming you can get that. How would that be invested? How would that be used by the HBCUs around the country? To either make up shortfalls, to help with students, infrastructure? How would you use the additional funding that Congress can give you?
Yes, sir. So Lane College, we have several strategies that we are using those funds for. Number one, we're using it to make our campus more safe for our students as they return to our campus. As I look at our numbers and our estimates in terms of where we are, I mean, we're going to need anywhere from $3 million to $6 million to $13 million to fully be able to convert Lane College from a residential campus to a hybrid campus that's offering classes online and face-to-face. So for our purposes, we're going to use those funds to support the students, to make sure this campus is safe, and to begin the conversion of this campus to be able to deliver at a high level our online courses. I mean, we will need those funds for a number of different, a diverse setup for additional staff, for learning management, for online services, to purchase digital devices, to purchase digital resources, data plans for our students. Our needs are significant.
Yes, sir. Yes, sir. Thank you. I appreciate that. Daniels, let me follow up. As you could probably guess, a Southeastern Conference senator is going to follow up on some of the sports questions that Senator Murphy and Senator Kane said. And they really have two. They asked several that I had. One would be, what steps will you try to take to try to minimize the risk to these athletes and the coaches going in? Certainly, you may have to shut down a program if you see something, but what steps will you take to minimize the risk? And second of all, the loss of revenue is going to be significant. The loss of revenue for colleges is going to be significant. What can Congress do to help make up for that? What are you going to plan on doing to make up for the lost revenue that supports not only your football and basketball programs, but also all of the other sports that you have at Purdue?
Senator, our athletic department is put together a very protective plan. There'll be a lot of separation, at least initially, between athletes. There'll be lots of testing, very regular testing to try to spot any infection at the first possible moment and do all the smart things about that. Again, we believe we could, in an outdoor setting, have at least a fraction of the fans. They'd have to enter in different ways and obviously be spaced in different ways. But we do think that part is possible and consistent with safe practices. But we're all in very new water here, and we may well change some of these directions as we all learn more. With regard to the dollars question, I'm not sure that a federal treasury that's already done what it's done, borrowed what it's borrowed, wants to be making up athletic shortfalls. We at Purdue, I'm proud to say, have always operated a self-sufficient athletic program, which we've never imposed a fee on our students who are not able to play and may not even be that interested in athletics as much as some of us are. So on the list of huge problems we've been discussing this morning, I don't want to minimize this one, but I for one would not urge that you place that high, nearly as high as, for example, helping HBCUs and some of these other goals.
Thank you. I was hoping that would be your answer. I appreciate that very much. Thank you, Mr. Chairman.
Thank you, Senator Jones. Senator Rosen.
Thank you, Chairman Alexander. Ranking Member Murray, I want to thank all the witnesses for being here today, for the work and care that you do to help our students and those that work at our universities. But I believe we really need relief for dreamers and our student veterans. And the COVID pandemic has severely impacted Nevada's colleges and universities and the students they're serving. That's why I was glad to vote for the CARES Act, which provided more than $6 billion to our institutes of higher education to provide emergency financial aid to students most affected by the pandemic. The new law intentionally provides significant flexibility to institutions in determining how to distribute funding among students, including those who are most in need. Unfortunately, the Department of Education has decided that not only students who are only students who are eligible to receive federal financial aid qualify for CARES Act assistance. This decision excludes student veterans, individuals who haven't completed the FAFSA application, and DACA recipients, many of whom have the added financial burden of supporting their parents, their siblings, their children, being the first in their families to attend college. In April, I joined a letter along with several members of the committee asking Secretary DeVos to reverse this decision to prohibit institutions of higher education from providing CARES Act emergency financial aid grants to undocumented students, but have not yet received a response. So Dr. Paxson, like our educational leaders in Nevada, you and your university have long supported protections for dreamers. Given this and the extraordinary situation in which we find ourselves, do you agree with the Department of Education's guidance excluding undocumented students from the CARES Act?
No, I don't agree at all. I firmly believe that if the point is to protect students who are the future of our country, we should be protecting DACA students, veterans, international students who are here in this country and need the support.
Thank you. I appreciate that. I'm going to ask all the panelists this next question, that the Department of Education, this guidance was given that excluded our student veterans. Veterans, they have served our country, protected our nation. Sometimes they're older students, they have families. Really important that they continue to get any support they need, along with those who don't fill out FAFSA applications for many reasons. Maybe they come from foster families, they're homeless youth, all kinds of reasons that those students aren't filling out, don't know how to do that. We want to know how your students are going to help, how you're going to help these students, and if you agree with that decision to exclude the student veterans. And let's begin with Governor Daniels, and we can go on to Dr. Hampton and then return to Dr. Paxson again.
No, thank you, Senator. I agree. These don't seem like wise choices. I frankly did not know about the impact on veterans, so thank you for drawing our attention to that. Other than that, I can just say, and as we did in to a previous question, that we're doing all we can to move money that to scholarships and to financial assistance. And we do anticipate that whatever shape our applicants were in just 2 or 3 months ago is very different today, and we're going to need to do more.
Senator, Lane College is a veterans-friendly institution. I am not aware of any negative impact that that this ruling had on the veterans at Lane College. However, for those several students that needed support who were not eligible for the CARES Act, we were able to fund those students through our Board of Trustees that made donations to support all of our students.
Thank you. Appreciate that. Dr. Paxson?
I would just reiterate what I've said before. You know, I think all students are equally deserving. Students who deserve on economic grounds to be supported need to be supported. We have not yet received any CARES Act funding. We're awaiting some guidance from the Department of Education. But our intent would be to support students equally as well as we can.
And I just have a few seconds left, but I just want to address the digital divide. I'm going to go really quickly. Of course, as we do distance learning, fact remains before coronavirus. Far too many college graduate students, of course, they lacked adequate broadband access. That happens in my rural communities up and down the state, in our underserved communities. So what can you do, or what are you planning to do to address this digital divide? Particularly in broadband, as it might apply to your students? And I guess you can go, Dr. Paxson, I see you first, so we'll let you go first this time.
So we have done a lot of work this spring, making sure all of our students have internet access from home or MiFi hotspots, and have done pretty well with that. Another thing we're focusing on is helping the city of Providence make sure that all of the high school students in the area have digital access, because that's been a huge problem for high school education.
Fantastic, thank you. Go on to, let's see, whoever would like to go next. I guess Dr. Hampton?
Lane College is sourcing and providing digital devices as well as hotspots for our students. And we're able to use the funds, the CARES funds, to fund some of that.
Perfect, and Governor Daniels?
Yeah, very similar answer. We had problems. Fortunately, they were fairly limited, generally in rural spaces, as you had suggested, and we were able to come with individual assistance, as far as I know, in each case. Also, we are blessed as a land-grant school with an extension service, so we do have offices in even very small population counties, and I think that gave us a little advantage in helping those who were struggling.
I appreciate that. I appreciate all you're doing. Thank you.
Thank you, Senator Rosen. I want to thank Senator Murray and her staff, as well as our staff, for their cooperation and their technical expertise today in this hearing. I want to especially thank the 4 witnesses who all have demanding schedules, who've made time for us. This is a more value than you might think to us and to our staffs and to the American people as they listen to President Daniel, Dr. Paxson, Dr. Logan, Dr. Benjamin. There is no more sure sign that the American life is regaining its rhythm than when 70, 75 million students head back to college and back to school, which is where we believe they will go. And our focus this month is to help make sure they go safely. Today, our discussion has been about colleges. Next week, we will be talking about kindergarten through the 12th grade, going back to school safely. We'll be having other hearings this month on telelearning, telemedicine, on looking ahead to the next pandemic as we continue our oversight responsibility. I'm going to include in the record a letter from the American Council on Education to which one of the senators referred earlier. That organization is an umbrella organization representing most of the 6,000 higher education institutions in the country. It asks Congress to consider a number of things, including properly constructed liability protection for students, for institutions as a result of COVID-19. I also heard that from virtually every one of the 90 Tennessee higher education institutions with whom I had a discussion by teleconference last week. The issue of testing came up, and my advice to colleges, for example, Dr. Hampton talked about Jackson, Tennessee. In our state, the governor has said, if in doubt, get a test. And I know that that works because I went to the public health department in my hometown of Maryville and waited about 3 minutes in line and got my negative test, which fortunately turned out to be negative a couple of weeks ago. So for colleges and universities who don't have large hospitals or their own capacity to create tests, my advice would be to be a part of the state's plan, because according to law, every state submits to the federal government its testing needs for the next month. And then if its needs cannot be met by the state, the federal government will help with that. For example, with swabs or reagents. Admiral Giwa testified before our committee that we should have 10 million test capacity in the country this month, which would be about, if my math is right, the 500,000 tests a day that was mentioned by Dr. Benjamin. He also said that he anticipated that there would be 40 to 50 million tests available per month by September. In addition to that, Dr. Collins is heading up an effort at the National Institutes of Health which we call the Shark Tank, which to create a highly competitive environment to see if we can find 1, 2, 3, 4 new ways of creating accurate, rapid tests, which would be tens of millions of more tests, so that there would be an ample supply this fall for universities. So my advice would be, if there's a question for a college or institution about testing, become a part of your state's plan and let the state look ahead and help with that. This has been a very helpful Now I have some words I'm supposed to repeat. The record will remain open for 10 days. Members may submit additional information within that time. Thank you for being here. Our next meeting will be next Wednesday, June the 10th, COVID-19, going back to school safely. The committee will stand adjourned.